When you hear the word Flurona, you might think it's a made-up trend used by TikTokers whose only goal is to get some views. Though it may sound made up, Flurona is very much a real thing. The first official case of Flurona was reported in Israel back in December 2021. Since then, many countries have reported such cases. Now that the word Flurona is entering our vocabulary, American magazine The Atlantic shared a report of a man in New York who allegedly had it in February 2020. The rest of the world is not doing any better either. According to the World Health Organization, Asia has a much higher number of Flurona cases than the rest of the world. But what is Flurona and what are the symptoms? Before we explain, consider dropping a like and subscribing to the channel. So, what is this Flurona everyone is talking about? Health officials from all over the world say Flurona is definitely a real thing, and more people are starting to get it. The woman in Israel who had it in December 2021 was admitted to the Beilinson Hospital. Since she was pregnant and unvaccinated, the doctors ran some tests and diagnosed her with both the flu and coronavirus. The word Flurona was thoughtfully used to name the experience, which can actually happen. According to Dr. Mark Loafman, chair of Family and Community Medicine of Cook County Health in Chicago, the COVID-19 virus and the flu virus are different enough that people can experience both at the same time. Here's what medicine knows about Flurona and what you can expect. Since flu cases rise during winter, which is at its peak in the Northern Hemisphere, there will probably be more and more Flurona cases. Researchers say that there are probably cases that have happened without our knowledge, like the man in New York in 2020. It's just that no one was paying attention to it. Flurona is a dual infection that can potentially cause more severe illness, but that may not always be the case. Any kind of dual infection can be quite dangerous or make your symptoms worse altogether. In the case of Flurona, the body is fighting a double infection with similar symptoms, which makes it hard to detect both, and doctors usually report one of the viruses. How can you tell the difference between COVID-19 symptoms and Flurona symptoms? Unfortunately, the symptoms of the COVID-19 and the typical flu are quite similar. According to the Center of Disease Control and Prevention, these are the most common symptoms of flu: sore throat, cough, headache, fatigue, runny or stuffy nose, fever or feeling feverish and having chills, muscle or body aches, and vomiting and diarrhea. The symptoms of COVID-19 include the following: sore throat, cough, fatigue, headache, fever or chills, diarrhea, muscle or body aches, nausea or vomiting, congestion or runny nose, new loss of taste or smell, and shortness of breath or difficulty breathing. As you can see, the symptoms of these viruses are nearly identical, which makes Flurona extremely difficult to diagnose. So, what should you do if you think you have Flurona? If you notice that you have symptoms such as the ones we just mentioned, you should follow the same guidelines that medical officials have been saying all along, unless you feel extremely sick. In that case, you should ask for medical help. If you do require medical help, doctors will determine which tests to perform. If you are not sure when to reach out for help, there are some symptoms you should keep an eye on, such as unusual chest pain, shortness of breath, and a fever that won't go away. Most of the COVID-19 complications are respiratory, so if you are experiencing any of the symptoms related to breathing, make sure you ask for help. And if you want to self-diagnose before reaching out to a professional, you should know that there are not so many at-home tests for flu, unlike COVID-19 at-home tests. But some pharmacies do offer tests for both viruses. However, you should leave such testing to the medical experts, as they will also run other tests. Can you get vaccinated for COVID-19 and Flurona? Since you are dealing with different viruses, you can get both vaccines at the same time. If you are already going in for your COVID-19 shot or a booster, you can get the flu shot as well. Additionally, getting both shots at the same time won't affect the efficacy of the vaccines. The shots may not prevent the infection entirely, but they can certainly help prevent things from going sideways. So, have you already heard about Flurona? Do you know someone who was diagnosed with both COVID-19 and flu? If you do, were they told it was Flurona? Let us know in the comment section below, and don't forget to subscribe because we have more videos coming your way.